Welcome back. You tuned into Salam Media, and this is your afternoon program, Inspired Afternoons, with me, your host, Mariam Mia. And now we're moving on to our next segment here. We am going to be speaking to two phenomenal physiotherapists in terms of the work they're doing. First of all, in educating the public in terms of better understanding COVID, in terms of how it infects your respiratory tract and what it does, and why do we experience that symptoms of difficulty in breathing, which sometimes results in our oxygen levels dropping and our difficulty to breathe, and we need assistance with breathing in that, but moreover, empowering us now. So I have Sister physiotherapist Sister Safiya Chicktay and Zaitoon Khan in conjunction with Greenside Oxygen, as well as with the support of Islamic Medical Association of South Africa. They've given their time in terms of the video that they have put together. And I must say, you know what, it was a highly educational and informative video, because it had a graphic there in terms of a picture of your lungs and what happens when the virus attacks, and why we experience the breathing difficulties, or most patients who test positive towards, I think, day 5 or 6 start having breathing difficulties. But not only that, giving us a step-to-step guide in terms of how to breathe with a PEP device, and mentally preparing us, because remember, to overcome being COVID positive and overcome the illness, you need to be mentally alert, mentally prepared to physically heal and fight the virus, to take this challenge. And you need to be armed. So basically, any battle you go into, the key to coming out successful is to be armed with information, with knowledge. And this is what these two physiotherapists has done, is made this video so that we can be better equipped in terms of dealing with the virus. So I'd like to welcome Sister Zaitoon Khan. First, Sister Zaitoon Khan hails from Springs. She qualified as a physiotherapist at the University of Witwatersrand. And after completing her community service, she's been working in private practice. She has experience in working with patients who are in intensive care, and that's what she's been doing for the past 11 years. And also currently, she has her own private practice in Benoni, and she also works at Glenwood as well as Lakewood Hospital, and as well as outpatient practice. She does home visits as well. And then we have Sister Safiya Chicktay, and she also is an experienced physiotherapist, having 15 years experience in both the public and private sectors. And her specialty is respiratory conditions, as well as musculoskeletal and sports injuries. Sister Safiya has worked in the UK as well, and that's, I think, where she's gained most of her experience in respiratory. She's become an expert in the field, focusing on respiratory infections and treating them thereof. And she's worked in a respiratory. She was actually a senior physiotherapist in charge of a respiratory care unit. So, alhamdulillah, we're in good hands. And this was just not some sucked in terms of the videos. You have experienced physiotherapists who have worked with patients who presented with pneumonia and other respiratory conditions, and nursing them to good health. Assalamu alaikum, and welcome, Safiya, to Inspired Afternoons on Salam Media.
Wa alaikum salam. Jazakallah for having us on your show.
And assalamu alaikum to you, Zainab, and welcome to Salam Media Inspired Afternoons.
Wa alaikum salam. Jazakallah for having us. It's Zaitoon.
Maaf Zaitoon. So Safiya, tell us, how did this video come about in terms of both of you conceptualizing this video, and why a need for this video?
Well, I am a volunteer of the Greenside Oxygen Initiative, as you mentioned, and this came about when there arose a need for patients to be managed at home due to the spike in the COVID infection rate and the bed crisis. So a group of doctors formed the Greenside O2 initiative in trying to manage these patients appropriately. And this is basically a COVID response initiative, and it is a collaboration between medical doctors, allied health.
Sister Safiya? Sister Safiya? Okay, let me just see if Ziad can help us with the line. Sister Zaitoon, so what do the videos entail?
Okay, so we've made a set of 3 videos. The first one is basic physiology of the respiratory system and how it affects, how the respiratory system is actually affected by the coronavirus. As we all know, this is something new. Every day there's new research going about, but whatever research we found, we've seen what the effects of the COVID on the respiratory system, and it's always good to know what we're dealing with. So that's the first part of our video. Also, there are other effects of the coronavirus like fatigue and muscle wasting and muscle pain. Then the second video is how to use a PEP device, as well as the breathing techniques, which would assist increasing our lung volumes and loosening of phlegm. The third video is basically the positions to relieve the shortness of breath. Like you mentioned earlier on, by day 4, 5, we have significant shortness of breath, and most patients at home don't know what to do with themselves. So in this video, also we give a bit of basic mobility exercises, circulatory exercises, which will therefore aid also in preventing muscle wasting long term.
Okay, and then I just want to check if Sister Safiya, are you back online with us? Okay, Zaitoon, maybe what you can do is while we getting Sister Safiya back online, if you can just, will you be able to explain to us, you mentioned the PEP device in the video, so explain to us what is a PEP device, please.
Okay, so a PEP device firstly stands for positive end pressure device. What does it mean? And how does it work would be that we're basically breathing against resistance. That's basically breathing into a certain amount of water, and this creates a back pressure, which is then transmitted to the airways, and this helps with the airways from preventing them from collapsing. And also it hyperinflates them a little bit, which whatever is in there also, like in terms of the vibration that happens through the water, we help loosen any secretions that are stuck at the bottom of the lung in the alveoli.
Okay, and is it difficult? So basically when I watch the video and, PEP device sounds like this, a heavy contraption or something very difficult, but in essence, your means of a PEP device, or how you facilitate what you told us in terms of getting the lungs and the excretion, is basically a 2-liter milk bottle container suffices as a PEP device. Am I correct in my understanding?
Yes.
We got Sister Safiya back. So, Sister Safiya, what I need to ask you is, you know what, as a volunteer, the videos have been presented as well, but then you're taking this initiative one step further in terms of, that's why the health professionals have been amazing in terms of this. Not only are you treating people in intervention in terms of treatment, but you are also leading campaigns in terms of arranging funds for oxygen, making them available, and then furthermore, milk bottle collection. So you're also heading in terms of obtaining PEP devices. So I believe there's a 2-liter milk bottle collection drive happening in Gauteng in order to make these PEP devices. So Sister Safiya, can you tell us more about this initiative?
Well, this initiative or drive was basically brought about by a group of physiotherapists in various areas of Gauteng, under the wing of Dr. Riaz Fadal, who is based in Bruma. And many physiotherapists are now involved with this drive. And we basically had an excellent response in the first phase of the drive. So we've already had 600 bottles made, using the milk bottles and the tubing, and we've had the tubing sponsored as well. So alhamdulillah, we've been very successful in creating these, in creating 600 of these PEP devices. which we will distribute to patients as needed.
So tell me, in terms of collection points for the devices, in terms of where can we do this? Is this all around Gauteng, or can we contact maybe IMA SA and will they refer us to will they refer us to probably the nearest collection depot in our areas? What is the best way in terms of anybody listening and they'd like to contribute?
Yes, that will be perfect. So you can either contact IMA or the GO2 initiative, and we should have a list of physiotherapists that are involved with this project and collection points. Or if there are particular physiotherapists whom are managing patients at home, they will provide the PEP devices to those patients.
Yeah, so I mean, you've made 600, but as we head towards the peak, or I don't know, some say we are at the peak already, we're definitely going to require, I think, double or triple of these devices. Am I correct in my understanding of that, Sister Zaitoon?
So we have collected in our initial stage 600, and although we stopped collecting, we have already over 1,200 bottles currently. So the rest of it is just being put together. So it's going to be an ongoing drive. We are also having people in KwaZulu-Natal that have taken on this venture in KwaZulu-Natal, as well as in the Eastern Cape in Port Elizabeth. So it's becoming a nationwide initiative. And like you said, we've just basically on the brink of what is happening with the COVID, and we don't know how long it's going to last. So in terms of our main need is to get it out there to people that are unable to even afford a 2-liter bottle. And also those that don't have clean water, we'd have to help them with those things as well.
Okay, so now, Safiya, what kind of 2-liter bottles are you collecting, and is there a specific reason in terms of the dimension of the bottle that you need or the shape of the bottle that you need?
Okay, so basically we're looking for 2-liter milk bottles, but it is important that it has a square base, and this makes a difference in terms of the pressure that we need in order for this technique to be effective. So that's what we are looking for.
Okay, and then Zaitoon, how do so if you can just inform our listeners as to how do we go about contacting yourself or Safiya or the other physiotherapists in other areas if somebody you know in the family or you yourself require one of these devices?
So like we said, it was a group of physios that started this. So we are now making contact with local doctors, especially the GPs, because they seem to be in the main, like the front line of assessing the patients, especially at home.
Yes. Mm-hmm.
Yes, at home especially. So that's our first thing. We are trying to do that. Also, like you mentioned, Imasa Kashifa Martin of the Joburg branch, she has all our contact details as well. So if someone is in need but their GP is not sure of which physio can help them, if they can contact Kashifa from a Joburg branch at Imasa. As well as the smaller branches of Imasa, like your Eastern branch, the Joburg South branch is also starting something as well. We'll all be able to help. The PEP device is not something that's new to physios. So all physios will be able to help you, even your physio that you're used to using. The only difference here is that it's a closed, semi-closed circuit, so that it's because of when you're breathing out, there will be some aerolizing of the particles, which will then be spread in terms of the COVID. So what we've done, we've adapted the PEP device with a lid and a hole at the top, so that this is specific for COVID. So it's just something that has been modified for the use. So like we said, any physio will be able to help you.
So this has been modified as a safety feature and a precaution for somebody who might be administering for the patient.
Yes.
Mashallah, I think there's also our ability to adapt and to pivot in terms of the circumstances. And like you say, you probably when you studied and you had to produce a device like this, you were trained in a specific way, and then you had to apply your mind now to say, how can we make this device safer in terms of whoever's administering not to contract the disease. So mashallah, well done in terms of that improvisation to the team of physios as well in terms of adding that safety feature. And Sister Zaitoon, why is it so important for a physio to administer these devices?
Okay, so if anyone does watch the video where Safiya explains about the inflammation in the respiratory tract, so in order for you to blow out, you must be able to have like normal airways. But now when you're blowing out, the airways are already hyper reactive and inflamed. So obviously, if you're just going to take any amount of water in any bottle, any tubing, you're not going to get the correct pressure, and you can actually become more breathless and cause more harm to the lung, which is already struggling. So a physiotherapist will be able to assess the level of respiratory function, number one. Also, if it is needed or not, because we can't just give this to anyone. And also how much of water is needed in the bottle. So also, like we said, it's an adapted device. So it's not just a normal PEP bottle that we normally mainly actually only we used as undergraduates and as graduates in pediatric patients. We are now using it in a closed system, which then affects the pressure. So we go back to our physics of high school, basically, of creating the correct pressure. So we've been very grateful that we've been guided by professors of the physiotherapy professors of the University of Witwatersrand. Although we haven't had any contact with them for many, many years, they've been quite easily available and gave us the guidelines, which we have put into a PDF as well. There's a document that we are giving now to GPs as well. Unfortunately, there's only so many healthcare professions, but like Safiya and the GO2 team, they are in other areas, all communities coming together with volunteers. So if we can enable everyone, it will ease the load of the healthcare professions as well.
So basically, Safiya, you're looking for volunteers maybe with a medical background or something like that, somebody who did a first aid course or did paramedics or something like this. Even I'm sure high school learners, they do community service that have gone to do first aid, because I know some of the extramurals offered it. Some of the high schools are first aid basic and then advanced as well. So somebody, a student like that would be helpful in terms of you being able to train them, because they have some knowledge in terms of breathing technique and these devices, and maybe they could be your auxiliary staff to assist it.
Yes, that would be very helpful. But the GO2 initiative is basically searching for anyone who has any skills to offer the initiative. So, I mean, we are getting members of the community as well who are offering their services in terms of not just the physio project, but also even just to do patient shopping and to help with transportation or fulfilling any need that these patients require and cannot fulfill themselves. So
yes, and that's what I loved about this approach, headed by healthcare professionals, but it's a holistic support system, because you realize you need the medical intervention, the physio intervention in terms of support services, and then, like you say, some because you're isolating, and families might be living in an area where they don't have family support in their geographic locality, and they might, like you say, a simple thing of shopping or something like that, or the children might need something and a mother is isolating. So you've created a whole network of a support system. So it's a complete support, and I think that's why we must commend our healthcare professionals, because you didn't only focus on the physical medical aspect, but in terms of all the auxiliary services that one would need while they are isolating and they're trying to overcome this virus, which really, it has a profound impact on the body in terms of it really attacks you. Like you're going to war, you feel as if you are battered and you really taking a hammering. Sister Safiya, am I correct in my understanding of this, and also testament from patients who have, I call it now, survived, because if you've come through COVID, really, you come out as a survivor, because it's actually an ordeal that the body goes through.
Yes, definitely. I agree with what you are saying, and it definitely has a profound effect on not only patients professional, but also their personal lives, because well, it's depending on the severity of the symptoms, but not only does it affect your respiratory system, but as a result of the reduced oxygen, patients are experiencing fatigue, they're experiencing muscular pain, and they're experiencing muscle weakness as well. And hence we have added ways of dealing with those effects in our third video, with our general advice and our positions and general mobility and circulatory exercises in trying to tackle those issues.
Perfect. And Sister Zaitoon, for those who have not yet seen the video, had access to it, is it posted somewhere on any social media feeds or places, platforms? Where, how can somebody view the videos?
What we can do is we can make it available to Salam Media if you'd like, as well. And then from there, it has gone quite viral. It's all over. We're just in the process of, inshallah, in the next week, we'll probably have it on a YouTube clip. And hopefully that would be a bit easier for everyone to share. If anyone is following, I have an Instagram page at Zaitoon Khan Physiotherapy, and it is shared on there as well. It's quite comprehensive and easy to use, and I think our main aim is to empower people at the end of the day. We don't know how long this is going to be around for, and even if we're not only using it for COVID, but in general after this, people will be using it for their chronic lung disease and things like that. It will just help.
Definitely, and I like to thank both of you for giving us your time coming on air, but more so for giving your time, because I know a video with so much detail in terms of the explanation, in terms of the expertise that you give out there, the exercises, the device you discuss. It must have took phenomenal amount of planning, and then just to do a production, get it together. I'm sure you feel like videos in themselves, so it took a lot of your own time away from your everyday work in terms of your practice to serve the community at large here. So I'd like to acknowledge you, and what I'm going to do is I'm going to speak to my producer here, and those at Salam Media, see if we can put it on one of our, make it available on our social media platforms as well, inshallah, as our small contribution to support the services you offer. And Sister Safiya, in terms of getting hold of GO2 initiative, how do we get hold of the GO2 initiative team?
Okay, well, what I can do is also supply those details to Salam Media, just so that there's a variety of specialists that you can get in touch with, so the public can access any of those contact details. Okay.
Jazakallah so much, and Jazakallah for coming on this platform and sharing of your time and your expertise. And inshallah, we wish you all the best. We wish you good health, and may the Almighty keep you under His mercy and protection, and keep you safe, and maybe use you to serve humanity at large, inshallah. Assalamu alaikum.
Ameen wa alaikum salam.
Shukran. We're going to go for a short break, and when we get back, we're going to speak to Brother Shakir Kesam, and we're going to learn about his journey of, I think, search, and his journey of discovery, where he found alternative way of treating long-term ailments, including what we all call a nature product, and this is confirmed by hadith and sunnah of our beloved Prophet sallallahu alaihi wasallam. So all that coming just after the break with Brother Shakir Kesam.